It is indeed a great honor and a privilege to appear before this esteemed house today. I sincerely appreciate the invitation to engage with you on the Ministry of Health's ongoing efforts to ensure the availability of quality, accessible, and affordable healthcare services for all Kenyans. The Senate plays a vital role in shaping national health policies, and I welcome this opportunity to present our initiatives and collectively explore ways to strengthen healthcare delivery across the country. This occasion also marks my inaugural appearance before this honorable House as Cabinet Secretary for Health. I take this opportunity to reaffirm my commitment to transparency, accountability, and constructive engagement with the Senate in advancing Kenya's health agenda. As we navigate the evolving healthcare landscape, I recognize the Senate's pivotal oversight role in ensuring that the government's health policies and programs effectively serve the needs of all Kenyans. As we move forward with the implementation of Taifa Care, our flagship model for achieving universal health coverage, I look forward to forging a strong partnership with this House. The success of this transformative health agenda depends on the collective effort of the executive, the legislature, the county governments, and other stakeholders. And I am confident that through close collaboration, we will make significant strides in realizing a robust, inclusive, and sustainable healthcare system for all. Honorable members, I will now move to the question by Senator Catherine Mumba. Honorable Speaker, honorable members, medicines used in the country must meet strict regulatory requirements to ensure safety, efficacy, and quality. They must be, first of all, registered and retained by the Pharmacy and Poisons Board. However, if a medicine is selected for inclusion in the essential list but is not yet registered in the country, it may undergo an expedited registration process to facilitate timely access. Secondly, it must be listed in the current Kenya Essential Medicine List 2023. Additionally, for these medicines to be available to the wider public, they need to be stocked by KEMSA as guided by Kenya Essential Medicine List 2023, Kenya Essential Medical Supply List 2023, and the Kenya Essential Diagnostic List 2023. Currently, KEMSA stocks a number of anti-epileptics or anticonvulsants such as lamotrigine tablets, valproic acid tablets and syrup, phenytoin tablets, phenobarbital tablets and injections, midazolam injections, magnesium sulfate injections, levetiracetam injections, gabapentin tablets, diazepam injections, and tablets. It is imperative that the counties draw these commodities from KEMSA to ensure consistent supply to the deserving patients. With regards to which pharmaceutical manufacturers, suppliers, and distributors are partnering with the Ministry of Health and KEMSA to ensure availability of these medicines, Honorable Speaker, honorable members, the KEMSA aligns its procurement of health products with the Public Procurement and Asset Disposal Act, the Kenya Essential Medicine List 2023, Kenya Essential Medical Supplies List 2023, and the Kenya Essential Diagnostic List 2023. There are 42 registered local pharmaceuticals or medicine manufacturers at various levels of good manufacturing practice compliance. To enhance local manufacturing of medicines in the country, the Ministry of Health in 2024 conducted a capacity assessment of the manufacturers, and the report of this assessment forms the basis of the development of a local manufacturing strategy for Kenya that seeks to incentivize innovation and production of health products. This will lead to an increase in local production of medicine in KEML 2023 from the current 20% to 50% by 2026. Again, all public procurement entities, including KEMSA, are expected to comply to the Preferential Procurement Master Rule List published by the Ministry of Investment, Trade and Industry that lists all products manufactured locally, including medicines. The capacity assessment report guided the updating of the Preferential Procurement Master Rule number 1 of 2024 to the current 223 medicines. Public procurement entities are expected to procure locally manufactured products from local manufacturers in order to promote Buy Kenya, Build Kenya strategy in support of local industries and the domestic economy. KEMSA does pooled procurement on behalf of all public health facilities, thereby maximizing economies of scale to yield better prices for its clients. However, KEMSA have had operational challenges, including stockouts of essential health products and technology due to financial constraints as a result of inadequate budgetary allocation and huge debts from county governments and other clients up to the tune of 6.2 billion. With regards to what steps the Ministry of Health has undertaken to ensure the life-saving medicines are included in the essential medical list and made ready available under the existing Public National Health Insurance Scheme, Honorable Speaker, honorable members, life-saving medicines are listed in the current Kenya Essential Medicine List 2023 edition, which is reviewed every 3 years and are captured under various therapeutic categories, including medicines of pain, anticonvulsants, medicines for anxiety disorder, medicines for mood disorders, among others. Further, the Social Health Authority aims to provide affordable, accessible, and quality healthcare services to Kenya as guided by the Essential Health Benefit Package that defines the services covered by the Social Health Insurance Scheme. SHA will use the Essential Medicines List to guide the reimbursement of health services and health products to health facilities for various conditions, including those provided for people living with disability. It's a bit. Thank you.
Thank you, Madam. CS. Senator Kadri Muma, do you have any supplementary question to the response? You have an opportunity to ask 2 supplementary questions.
Thank you, Honorable Speaker. I have 2 supplementary questions. Thank you, CS, for the questions. Although the answer was not brought prior, so I was not able to read through, but I appreciate what you have just presented. My 2 supplementary questions are as follows. Does the Ministry of Health have a policy that provides relief for persons with disabilities or families with persons with disabilities to ensure that those who require the life-sustaining medication are able to access those medications for free? My second question, what is the ministry planning to do to ensure that KEMSA is reorganized to be the inter-county authority that it should be rather than a national government authority, because KEMSA actually provides services to the counties? Thank you very much.
Madam CS.
Thank you very much, Senator, for the questions and concerns. Indeed, we have a health insurance subsidy for people living with disability, and again, working together with the social protection under the social, the people with severe disability are incorporated and are being paid for under the Social Health Authority. That way, they will not incur any costs. The government will take care of them in matters in matters health insurance. Additionally, we ensure that the medicines are again cost effective, and we are having cancer reforms ongoing to ensure that we promote inter-county engagement between KEMSA and the county. Thank you.
Next, if she has responded to the 2 questions, supplementary questions, or 1?
Honorable Speaker, I'm not too sure that she has responded to the second one, reorganization of KEMSA.
But also, Senator Catherine, you know, your question was not related now to the KEMSA issues, but was on these drugs for the PWDs. Because standing on the 51C7 is giving us very clear guidance that two supplementary questions that relate to that question. Because, and also I'm speaking out to all the, have you said, Madam CS? I'm now speaking to all the senators in the House. I know how there are so many questions that you would wish to ask, but then these questions should be grounded on this, the principal question that Honorable Catherine Muma asked. So maybe, because it is your question, let me give you that opportunity, but next I will not entertain any questions outside the primary question, so that we can make progress. And also there are many questions, three other questions, which maybe if you wait, the issues you are listing now still can be dispensed of during the other questions that we have, because the CS has three more questions to attend to. Madam CS, on the reorganization of KEMSA to fit the county issues and remove it as a national entity. That's the question she had asked.
Honorable Speaker, Honorable Member, I kindly request for us to have a comprehensive report from KEMSA detailing what policies and reforms are there to ensure